The ODYSSEY trial was a large multinational trial which was conducted in over 57 countries, looking at a high-risk patient population, 18,924 patients who had had an acute coronary syndrome within the past year. The median time since the acute coronary syndrome event was actually about 2.6, 2.8 months. So a very high-risk patient population. They were randomized to either Alirocumab at 75 milligrams subcutaneously every 2 weeks or 150 milligrams subcutaneously every 2 weeks, or placebo. This was a very well-treated patient population. They did have to be on maximally tolerated statin therapy. In fact, the majority, nearly 90%, were on high-intensity statin therapy, and another approximately 8 or 9% on moderate-intensity statin therapy. So a very well-treated group of patients. They were followed for approximately a median of 4 years over time. And the primary endpoint of this trial was coronary heart disease death, myocardial infarction, stroke, or hospitalization for unstable angina or coronary revascularization. So at completion of the trial, there was an absolute risk reduction of 1.7% in the primary endpoint. Now, it was very interesting. One of the things that they did observe, that there was a drift upward in the LDL cholesterol level over time. There was initially about a 60+% reduction in LDL cholesterol. However, over the course of the trial, the efficacy was somewhat lost over time to about a 55% reduction. It is unclear how much of this was related to possibly adherence-related issues, or the fact that in this trial there was a dose titration protocol. And that is that they were titrating to an LDL cholesterol level between 25 and 50 milligrams per deciliter. If patients had a less than 15 milligrams per deciliter level of LDL cholesterol on 2 consecutive occasions, the Alirocumab dose was either down titrated or completely discontinued based on their dose. So this may have contributed to the drift upward or loss of efficacy over time in the LDL cholesterol level. Now, an interesting outcome, although the primary endpoint was found to be positive with about a 15% relative risk reduction, there did appear to be the greatest benefit, particularly a nominal, possibly mortality benefit, all-cause mortality, that seemed to be greatest in the group with the highest baseline LDL cholesterol, greater than 100 milligrams per deciliter. Time will tell as we get a more in-depth analysis of if this represents a true mortality benefit. Certainly we have not seen mortality benefits in overall other lipid-lowering trials. It will be interesting to see if, when we look at perhaps meta-analyses of other trials, if we see similar findings to come. So I think the clinical implications of this trial are that we have a second PCSK9 inhibitor, which now has proven cardiovascular outcomes benefits, and we will need to stay tuned to understanding more clearly what are the patient populations that are most likely to benefit.